At Humana, when you tell us what you need and want, we hear you. To help you find the right plan for you, we'll begin with an overview of Medicare. Medicare is a health insurance program run by the federal government. It has 4 parts. Part A, which covers hospital stays. Part B, which covers medical needs like doctor visits. Part C, also called a Medicare Advantage plan, combines Parts A and B, plus it could give you other benefits. And finally, Part D, which covers most prescription drugs. Together, Part A and Part B are called Original Medicare. Step 1 is to enroll in Original Medicare, offered by the federal government. Step 2 is to explore additional coverage. You may want to enroll in a plan through a private company, or if you want to add additional coverage to Original Medicare, you have a few options. You could choose Part C or Medicare Advantage plan. These plans give you all the benefits and coverage of Original Medicare. Our Medicare Advantage plans may also give you extra benefits, and some may include Part D drug coverage if you choose an MAPD plan. Humana also offers individual dental and vision plans, as well as combined dental, vision, and hearing plans. These can be purchased by Medicare Advantage enrollees wanting additional coverage. Our individual Medicare options can be added to your coverage. You could choose to add one or more of these options to Original Medicare: a standalone prescription drug plan, or PDP, for Part D coverage, or a Medicare supplement insurance plan to help pay for any out-of-pocket costs you may have with Original Medicare, or an individual dental and vision plan, or a combined dental, vision, and hearing plan to help ensure coverage for all of your healthcare needs. PDPs are often called standalone prescription drug plans because their Part D coverage stands alone as its own type of plan. To get Part D coverage through a standalone prescription drug plan, you could add it to Original Medicare, or you could add it to a private fee-for-service or PFFS Medicare Advantage plan. You could also choose to get Part D coverage from a Medicare Advantage prescription drug plan, or MAPD, which combines Parts A, B, C, and D. Most people are eligible to enroll in Part D as soon as they're eligible for Parts A and B. Remember, if you don't enroll in Part D coverage when you're able to, you may be subject to a penalty. If you choose a Humana prescription drug plan, we offer 3 options. There's the Humana Value RX plan. This plan is great for those who primarily use generics and want a lower premium. It has a large network of preferred cost-sharing retail pharmacies, including many supermarket and mail-order pharmacies. It's designed to keep costs consistent and predictable. Then, there's the Humana Premier RX plan, our most robust PDP option. It offers coverage for over 3,000 drugs with a reduced deductible. Finally, there's the Humana Basic RX plan. This is a good option for those who qualify for Extra Help, the low-income subsidy offered by the government, which we'll cover in greater detail in just a moment. Every PDP comes with its own drug list to give you a sense of your medicine costs. Prescription drugs are organized into tiers according to cost, with Tier 1 being the lowest cost and Tier 5 being the highest. On all of our PDPs, you may pay a lower cost using our network pharmacies with preferred cost sharing. For these plans, CenterWell Pharmacy is the preferred cost-sharing mail-order pharmacy. Humana PDP members also receive a 20% discount at the CenterWell Pharmacy online over-the-counter store. Other retail and mail-order network pharmacies are available. If you're considering a plan that includes prescription drug coverage, there are a few important things to know. Most Medicare prescription drug plans have 3 stages. In the deductible stage, you pay all costs until the deductible is met. A deductible is the amount you pay for your medication costs before the plan pays its share. Deductible amounts and exclusions vary across plans. Some plans may exclude commonly used medications from the deductible phase. During the initial coverage stage, the plan pays its share of the cost of your covered prescription drugs, and you pay your share, your copayment or a coinsurance. Both you and your insurance plan pay medication costs until your Part D out-of-pocket costs reach $2,000. You then enter the catastrophic coverage stage. During this stage, you pay nothing for the remainder of the calendar year. The plan is responsible for the full cost of your covered Part D prescription drugs. If you think you may need help paying for your prescriptions, ask your sales agent about Extra Help or the Low-Income Subsidy Program. It is a government program that helps people who qualify pay for their prescription drug costs. It's also good to know that some prescriptions require step therapy. It means that even if a medication you take is included on your plan's drug list, you may need to try certain drugs first before moving to a more expensive drug. And last, prior authorization. It's a type of approval your doctor is required to get from your plan so they can prescribe certain medicines. Now, let's cover when you can enroll. The first opportunity is your initial enrollment period, or IEP. This date depends on when you turn 65. Your IEP begins 3 months before and ends 3 months after your 65th birthday month. During this time, you may enroll in Part A, Part B, or both. You may also choose to enroll in Part C instead or add Part D. You are not required to enroll in Part D, but you may face a late enrollment penalty if you go 63 days or more without prescription drug coverage after you're eligible. You may pay an extra 1% of the average monthly premium for each month you delay enrollment. You can avoid the penalty with prescription drug coverage through Medicare or with creditable prescription drug coverage that is expected to pay at least as much as Medicare's standard prescription drug coverage, such as a Humana Part D prescription drug plan, an insurance plan from your employer, or VA healthcare coverage. October 1st through October 14th is your chance to begin reviewing plans for the annual election period. Use this time to compare plans so you'll be ready to enroll beginning on October 15th. You cannot enroll before the 15th. The next important enrollment period is the annual election period, or AEP, from October 15th to December 7th. During the AEP, you can enroll in a Medicare Advantage plan with or without prescription drug coverage, or a standalone prescription drug plan. Certain life events may qualify you for a special enrollment period, or SEP. These are times outside the other enrollment periods when you can enroll in, drop, or change your plan depending on your eligibility. Before you enroll, your sales agent will go over a few important documents. This includes your plan's drug list, as well as the summary of benefits to help you understand the benefits, coverage, and rules for your new plan. They will also provide information on star ratings. These are ratings from the Centers for Medicare and Medicaid Services, which evaluates certain Medicare Advantage plans based on real members' experiences. Let your agent know if you'd like more information. If you want to know how to file a complaint or would like to see a full list of your plan's costs, benefits, and rules, you can consult your copy of the Evidence of Coverage. If you sign up for a Humana plan, we'll send your ID card in the mail. You can choose to receive other plan documents online through a secure digital account at MyHumana. Humana believes better care begins with listening. That's why your licensed sales agent is here to get to know you, your healthcare needs, goals, and more. They'll review the plan's pharmacy network, premiums, costs for prescription coverage, and benefits. Your agent's goal is to help you find the right plan for you.